question. Ion metabolism is another topic which is repeated so frequently in INICET exam. First, let's revise quickly the topic of ion transport, and then we'll come to the match the column question. So, what is that transporter which is present at the luminal surface? So, if this is the intestine, it has the cells. So, what is present at the luminal surface which takes the dietary ion into the intestinal cell? What is that which is present at the luminal surface? Remember, it is DMT1. DMT1 is present on the luminal surface. When I say DMT, it is divalent metal transporter. So this ion, it is carrying in what form? What form ion is absorbed from the diet? Fe2 plus, divalent metal transporter, Fe2 plus. Now this ion here, right? This ion here in the intestinal cell, from there it goes into the blood. So what transporter is taking it into the blood? What do you have on the basolateral surface? It is ferroportin. Okay, it is ferroportin. And in the blood, iron is bound to, what is the iron carrying protein there? It is transferrin. Important. Transferrin carries what form of iron? Ferrous or ferric? It is the ferric form. Okay, it is the ferric form. So at this level, right, when it is coming out, the iron is converted to ferric form. By what compound? What converts it to ferric form is the hephaestine. Okay, hephaestine converts it to ferric form. Okay? Even ferritin, the stored iron, is also in the ferric form. So look at this one, the DMT1 at the luminal surface, it basically takes in Fe2 plus. Fe2 plus then goes out via this ferroportin. Fe2 plus is converted to Fe3 plus by hephaestine. And what is the role of hepcidin? Don't confuse hepcidin and hephaestine. Hepcidin is what you can see is blocking. It is inhibiting ferroportin. So it is not allowing the ion transport to happen into the blood. Okay, it blocks the ferroportin. Is this clear with everyone? So what happens in your primary hemochromatosis? What happens in hemochromatosis? We have discussed this in short. In hemochromatosis, hepcidin is low or hepcidin is high? Yes? Hemochromatosis. What happens in hemochromatosis? It is hepcidin. Increased activity, decreased activity. Yes, Saranga? Hepcidin low. That is why this is not getting inhibited and a lot of iron is coming into the body. Hepcidin is low in hemochromatosis. Okay, clear with everyone? Hepcidin is also an acute phase reactant. Remember, it increases in inflammation. Okay, it increases in inflammation, hepcidin. Okay, now coming to the options that we have here, DMT1, match the column. So mediates the transport of ferrous ion across the apical membrane of enterocytes. This is going to be DMT1. So 1 is going to be B. So where do you have 1 is B? Either option A or option D. That is how you tackle your match the column. It's not B or C. Coming to ferroportin, which is ferroportin, which facilitates the efflux of iron from enterocytes and macrophages into the systemic circulation. So 2 is D. 2 is D. 2 is C here. So this is gone. The correct answer becomes your option A. Match the column are ones of your easy scorers in INICET exam. Okay. Hepcidin, 3 is A according to this option. So induces internalization and degradation of the basolateral ion exporter. So basically inhibiting ferroportin. It causes the internalization and degradation. Transferrin is C. It binds to ferric ion. It is a major ion transport protein in plasma. Is this clear with everyone? Which of these proteins or compounds that we have spoken about requires copper? So that is how the iron and copper metabolism is interlinked. Remember this hepcidin, this hephaestine, not hepcidin, requires copper. Okay, it is requires copper. It is a copper dependent oxidase, oxidizing ferrous form to ferric form. Okay, so hephaestine is what requires copper. Okay, clear with everyone?